Welcome back. You're tuned into Inspired Afternoons, and now it's our health and wellness segment brought to you by Path24 Laboratories. And I have Professor Shahed Omar joining us once again. He is one of the chief pathologists at Path24, as well as head of critical care or ICU care. Very, very, very knowledgeable and accomplished medical practitioner. And today we're speaking about the big C. We speaking about understanding. Right, wait for it. He's going to tell us what this means. I'm putting it out. He's already laughing here because some of the medical terms are tongue twisters here. So let's go for it. Dyslipidemia, the silent risk
Okay,
heart health with professional.
dyslipidemia.
Dyslipidemia, the silent risk to heart health. So assalamu alaikum wa rahmatullahi wa barakatuh, and thank you for the English lesson and correct pronunciation. So please fire ahead with what does that mean.
Exactly. Thanks. Walaikum salam wa rahmatullahi wa barakatuh. And walaikum salam, salam alaikum to all the listeners, all the viewers as well. Okay, so we're going to get straight into it. Dyslipidemia. So, dyslipidemia is actually a word. Dys means abnormal, and lipid means fat, and emia is in the bloodstream. So, in other words, what it really refers to is an abnormal fat level in the blood. So, and we usually measure this by looking at our cholesterol tests, or what we call the lipogram. And we know we've all heard of good and bad cholesterol. And what we do know is that cholesterol accumulates and silently. So we're not actually aware that anything is happening until some major catastrophic event. So you might have a heart attack or a stroke, and then you realize, oh, this has been happening all along. So with that in mind, this is a silent disease, and we have to actually screen and look for it and try and manage it as best as we can to avoid its consequences.
So let's go back to the origins of this. Where does this cholesterol come from?
Okay, so cholesterol. So we're going to remember that cholesterol is actually important in the body. So there'll be a natural production of cholesterol in the body by the liver, and that's the slide on the right. But I'm not going to start there. I'm going to start with the slide on the left, and you can see that an important source of the fats and cholesterol is from our diet. So we have, a high fat diet, or especially in this month, we're going to remember all the fried foods that we eat, and the pastries and so on. And we got to watch out all those things. But there we have a fat intake, and then our body digests it, and these fats get absorbed in the gut. Now, one of the things that the fats actually, to be transported in the bloodstream, they have to be packaged. So they get packaged into a little molecule called the chylomicron. And what happens is that this package, as it goes along in the bloodstream, it reaches the tissue. And some of these fats can be removed and stored in our adipose tissue or fatty tissue. Sometimes some of our tissue uses this as a source of energy. So things like our heart and skeletal muscle can use fat as a source of energy as well. So what happens is that as it goes along, some of it will get stored, some will get used up, and at the end, this little chylomicron will become a remnant. And this remnant will then be taken up by the liver, and it will be recycled, and it can be reused, repurposed for another process in digestion. So this will be useful, but if it accumulates, then it can have harmful consequences. Now, if we look, that's what we talked about just now was just the fat consumption. So you can already see that if we eat too much fat, there can be consequences. But on the right, you'll see that the liver also produces some of these fats and cholesterol, and they produce it in a molecule called the VLDL, or very low density lipoprotein. But essentially, why does liver need to produce this? Because remember, cholesterol is an important precursor for many important hormones in our body. For example, our steroid hormones, the adrenal glands will use this, so they will need this precursor. They will need these fats to use cholesterol as a base to create those hormones. Our skin uses the cholesterol to synthesize vitamin D. So we do need cholesterol and we do need these fats. But the problem comes in when we have excess. So let's look at the liver. The liver will produce this VLDL molecule, and the same sort of process will happen. It'll get transported in the bloodstream, and as it gets transported, it'll go through various tissues, and sometimes storage can happen. Sometimes it can be used as a source of energy, and then at the end, the particle left over is what you all have heard of, LDL, my LDL cholesterol. I'm sure you've all heard of this. What's my LDL cholesterol? You know, we talk about it as the bad cholesterol. But when there's this LDL eventually then gets taken up by the liver by a receptor called LDL receptor, and then it'll also get repurposed. But what happens is when there's too much cholesterol or LDL cholesterol, then these LDL receptors get downregulated. And in fact, now you have an excess of LDL in the bloodstream. And that's when problems can occur. So you can see that there's two pathways or two sources or two production sites. One is our own consumption and one is the liver. And fats are important, but obviously they become harmful as they when in excess.
So basically, that's what. So we have the liver has the capacity to generate the own cholesterol, and then the other cholesterol is obviously from our food intake that when we get. So those are the two sources of cholesterol.
That's correct.
Okay.
Absolutely.
And then
Perfectly
what you're saying,
summarized.
yeah, okay. I'm just trying to understand this through my English brain and not biomedical brain, right? And then so the excess is so the excess now is what you call now that LDL, right? So the excess.
Right.
But then this excess, where does it get stored? In your bloodstream or along your heart chambers? Or where does the excess start building up?
Okay, so good. So now the excess LDL cholesterol, what happens is that remember when the levels go too high, so maybe we might consume too much, and then there's an excess of LDL cholesterol, and this can't be taken up by the liver and excreted by the liver. So what happens is that it accumulates in the bloodstream. Now, when LDL accumulates in the bloodstream, that's when it comes into contact with free radicals, and these are molecules that will basically oxidize the LDL. So once they oxidize the LDL, because the LDL gets exposed to this in the bloodstream, now this LDL becomes activated. So you want to call it as some sort of activated LDL, and uh, and um, and now it becomes really poisonous. So what happens is that the blood cells. Remember, we had that 2 weeks ago. Prof. Karodia told us about all the blood cells. Now, one of these blood cells, uh, they call them macrophages. These will come in. They will engulf this oxidized LDL and they will take it up. And then obviously what happens is as these cells go into the different tissue, different blood vessels of different tissues, then this fat is now carried to these arteries, and these basically gets deposited here. And this is what we call basically fatty plaques. And they can, as you can see on the picture on the right, you can see that we have a normal blood vessel without any fatty plaques on the top. And as the fat gets deposited due to excess, slowly there'll be occlusion of the pathway to blood. So you can see that now the blood has a bit of resistance to get to the tissue, in this case the heart, and because there's an inflammatory component, this can cause further enlargement of this fatty plaque and hardening of the blood vessels, and these plaques can actually even rupture, and they can totally occlude the blood vessels. And when these blood vessels are totally occluded, no blood can get through. And if no blood gets through, then what happens is that there can't be any oxygen delivery to the tissue and no nutrients. So, and obviously, our tissue needs oxygen and nutrients to survive. So now imagine if you have a heart muscle that suddenly can't get blood supply, then it gets starved of oxygen, and then we call it a heart attack or a myocardial infarction, and that heart muscle dies or infarcts. And the thing about this is that it can't regenerate. So now suddenly you have less heart muscle trying to do the work of for the rest of the heart. So the heart that has to cope is obviously now less functional or less has less functional muscle. So the issue with too much LDL cholesterol is ultimately it ends up in plaques in the arteries, and we call this atherosclerosis, which is really sclerosis is hardening of the arteries, and athero means are these lipid plaques. So this is a disease of blood vessels, and they ultimately affect the organs that blood needs to flow to via them.
This sounds really, really fatal. I mean, if not kept in check, we're going to go for a short break. And when we get back, no doubt I have several questions here. So while we unpack everything to do with cholesterol, all this after the break with Professor Shahed Omar, brought to you by Path 24 in the interest of good optimal health.
Salam Media, your spiritual companion this Ramadan.
You know, it's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying, or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
For the first time, I can dream again.
The Africa Muslims Agency Orphan Hope Program provides the food, clothing, and basic support needed by thousands of children across the world. Every child deserves a chance at a hopeful future.
For 50,000 rands, you can transform our lives with the AMA Orphan Hope Program.
Africa Muslims Agency, empowering, educating, inspiring.
The Prophet Muhammad, peace be upon him, said, "Use the black seed, for indeed it is a cure for every disease except death." This Ramadan, honor that guidance. Tip Black Seed supports your blood sugar during fasting, boosts immunity, sustains your energy from suhoor to iftar. Available at leading pharmacies. Tip Black Seed, your golden drop every day.
Elite Basmati, available throughout the Middle East, and now for the very first time exclusive to South Africa, brought to you by Murchison Spice, Pietermaritzburg's most famous specialty store. Elite Basmati, available in aromatic white and golden cellar, is packaged in a world-class facility in India and is filled with wholesome goodness for your well-being. Elite Basmati rice by Murchison Spice. For trade inquiries, contact Mohammed on 033 387 2121. Murchison Spice.
You are listening to Salam Media live from our headquarters in South Africa. This is Salam Media, keeping you company this Ramadan.
Welcome back, and this is Inspired Afternoons with me, your host Mariam Mia, and we are discussing cholesterol. Yeah, it was intended because it's Ramadan, the samosas, the spring rolls, the moons, everything is fried, deep fried, and the chips. Yes, today's a Ekelwaya's day here in Gauteng. So all that I see Professor Omar laughing also. Yeah, because that really is cause for concern. So let's just find out from him. Frying in that oil, good cholesterol or bad cholesterol? We all kind of know the answer now, but let's just try. It never hurts to just check and find out those deep fried goodies. What of them? And then if they are good cholesterol, where do we source them and how do we get them? In what food sources can they be found?
Yeah. So firstly, the bad food is we always look forward to it. I know here at Barra we used to have also an Ekelwaya's day, but that was 20 years ago. I don't think I can eat a lot of aquavires now, but definitely from time to time we actually feel for those fatty foods and so on. So let's look at so we had on the one side the LDL taking the cholesterol to the blood vessels. But what we also know is that there is a good cholesterol. And the good cholesterol, when you do your lipogram and you do your blood test, they'll tell you that this is HDL, or high density lipoprotein. And this cholesterol actually takes or picks up cholesterol or fat from the blood vessels and takes it back to the liver. So that's why we call this a good cholesterol. So it actually has, you can think of it roughly as the LDL basically depositing the cholesterol or in the liver by the foam cells, and then the HDL transporting the fat to the liver from the vessels to the liver. So you can already see that when we look at our lipogram, a good profile will depend on the balance of good and bad cholesterols and total fat. So it is important to realize that the role of HDL. Okay, although there isn't too much we can do about HDL, but there are some things that help to keep our HDLs high.
So
Okay.
before we go on to the lifestyle and what diet you do to keep factors at bay or to keep your cholesterol in check, how does one what does a cholesterol test entail, and what from the results of the test? So once you've diagnosed this from the results of the test, what information will that give the medical practitioner once you've done a cholesterol test? So talk us through a cholesterol test. Is it a blood test, or what type of a test it does? And from the results, what can you determine from the cholesterol test?
Okay, great. So a cholesterol test, so we typically, our doctors will tell us, and sometimes our medical aides, make sure we do this once a year. So we call it a lipogram. The lipogram is a full profile of the full fat profile in your blood, and a total cholesterol is just the total cholesterol only. So usually the doctor will request a lipogram. Now, one of the things we have to do is part of the lipogram is a test for fat or triglycerides, and to get an accurate value for that particular component of the lipogram, we need to fast for 10 to 12 hours. So specifically for the triglycerides, if you want to get an accurate reading there, we'll need to fast for 10 to 12 hours, and then we'll do this blood test. So your doctor may say, look, I want the full lipogram, and therefore I want you to fast. And if he just wants the cholesterol components, then you may not have to fast. So just remember that that's one thing that will come in play. You'll have to have probably an overnight fast, and then you go to the laboratory, and they will take your blood as per usual, and it's a yellow tube that they'll draw. They usually draw one tube, and sometimes this test is accompanied by other tests like glucose and HbA1c that we've talked about previously. So when we get our results, and I think this is the important part, that we'll get a total cholesterol value. And now, assuming that you're a reasonably healthy person, you haven't had any heart attacks or any cardiovascular events, so then your target, your doctor's going to say, look, depending on your overall picture, he's going to say, look, I want probably a target below 5 millimoles per liter. So I'm just going to use 5, and the units are always provided. So we want a total cholesterol less than 5, just to make it easy for you to remember. Okay, and that's the total amount of cholesterol. Now, when you break that down, you'll see that there'll be something called the LDL cholesterol, and we talked about it just now, the really bad cholesterol. And typically, once again, if you this healthy profile, or I'm calling it apparently healthy profile, you haven't had any major events, then the doctor will want you to have a value of under 3 millimoles per liter. So this will be the target. But now just remember, if you're a higher risk, you may say, we want this target actually lower, maybe less than 2.5. And say if you've had a heart attack and now you're recovering, and your doctor may say, no, wait a second, here we actually need it much lower. We want it below 2. We want it 1.8 millimoles or lower. So you can see that there will be different targets for different people. But if you're an average person that hasn't had a heart attack yet, or hasn't had a stroke and hasn't had a vascular event, then you're probably going to have, and you're in reasonably good shape, then you're going to want to have a value below 3, and the lower the better, because you saw that this is a progressive process. It happens over time. It's silent. And so you want to keep your cholesterol as low as possible. Okay.
Okay, so that's something important to remember, that it's going to be based on an individual's risk factors, maybe genetic, if there's a genetic history of heart disease in the family, that will come into play as well. So that will all determine, so the level and what it needs to be at in check will be up to the individual, and obviously a thorough medical history will determine then where you need to be in terms of your level. And then something important you said, this is one of the tests we can be proactive with, right? And so at what, so you said once a year. Now I'm going to ask you, if maybe let's say there's not much of a history of heart disease or that in the family, and you're relatively active in it, at what age should you do your first test?
Yeah, cholesterol. Yeah, good. Okay, that's a good question. Look, we your doctor will look at your risk profile, and traditionally we look at premature vascular events. So, we used to say that if a man has a heart attack before 55 or a woman before 65, that's premature. But obviously now, from an age point of view, I think even if you're much younger and you've got high risk factors, high BMI, obesity, diabetes, it doesn't matter what age, you're going to be tested. So I think anybody, it's going to depend a lot on your risk factors. And if you have risk factors, then age doesn't matter. You're going to want to test. So just remember that those, where we used to think, for older people, that was, a long time ago, right? At the moment, currently with our knowledge, what we have is we risk profile patients, and if you have risk factors, then you need to be tested. Okay, so that's important.
And then somebody who does not present with high risk, you think somewhere around 35, 40, is it a good time to start? Then you're in the test.
I must look at, now I'm just looking at guidelines. I haven't got a number for you, but I'll
get on the spot today. I put you on the spot.
No,
I'm just, I'm a person that likes to be proactive, when it comes to, so not because the doctor will tell you, but I'm the kind of person to say, okay, I think I'd like to have a cholesterol test just to know, because I'm feeling fine, but I just want to carry on with this good health, alhamdulillah, and the longevity of having good health. So, and just continue your busy lifestyle in contributing various.
I must say 45 is too late. You've got to be doing this much earlier. So definitely, even if you don't have those factors, you'll be looking, at least a decade earlier. You want to know.
35.
Okay, you want
35
to, I mean, look, I think even if you look at screening programs for your medical aids, I mean, they do it on everybody. So they're checking your cholesterol, even, young adults.
And I think most medical aids are also proactive now, because they encourage these type of tests, which they pay for, and it comes up. Part of your benefits would be there. So listen, there's no excuse not to do this test here. And I think, maybe you're not the right person, but I'll have to get somebody then for the layers. Is just offhand, are these tests very expensive?
So, I must tell you that, so obviously, if the medical aid will cover for it, your cholesterol screening usually covered, by the common medical aids at any age. So, and remember, just to emphasize that the sooner cholesterol starts accumulating, literally from birth, if you want to look at it that way. So, you really want to know what your cholesterol is early in your life. You don't want to wait until you're 35 or 40. You want to know it as soon as you can, and you want to track it. And the other thing about what you asked, so from medical aid, there are medical aid rates, but now there are a lot of discounted rates for patients that actually, don't have medical aid or will have a saving or won't have a savings account, etc. So you'll see these tests are not, they're not exorbitantly expensive. It's certainly not thousands of rands. There may be a few hundred rand.
Okay, no,
So
it's good to know. And I like you say, most labs, including Path 24, have cash dockets, and you can ask for the cash docket for those who do not have medical aids. And you're a private patient, you get a discounted a cash rate there. So it's in your interest to spend this couple of hundred rands because as I've always said, your health is your wealth. Now, yes, we know if you present with high cholesterol levels, especially the LDL cholesterol, right? That's your bad cholesterol. Look, I'm learning. I'm not a bad student in my old age here. So what I'm saying is, we know first of all the fries and the processed foods need to be at extreme minimal, maybe 3 cheat day, maybe once a month or something like that. But by far large, have a healthy, balanced diet include lots of the greens in your food, lean proteins, cut off all the fats and things like that. But if there might be a time when diet alone will not cut it in terms of bringing your cholesterol level under check. Is there? I'm sure there are a lot of medications on the market that you take that will be prescribed for you to help keep your cholesterol levels at a safe level according to your risk factors and who you are. So, what type of medication do you use, and is it then going to be like a chronic medicine? It's going to be long term, or it's just for that while and that. What if you need to take combination medication and diet? What type of medications do they prescribe for cholesterol?
Okay, so the common drug that we all familiar with are the statins. So obviously lifestyle, lifestyle is important. Like you mentioned, we want to make sure exercise, and we talked about exercise goals for diabetes. Very similar, you want to have a good 1.5 hours or 2.5 hours a week. At least 30 minutes a day of good brisk walking or cycling or swimming or something like that. So exercise very important, and then the diet. From a diet perspective, remember there's different types of fats. So the really bad fats are the what we call the trans fats. So those are the deep fried things. The deep fried things. So you got to really be careful about of those. And then the second worst are the saturated fats. So there will be animal fats, creams and cheeses and red meat and so on. And then the better fats are obviously the mono and polyunsaturated fat. So
Those would be
those
the
are,
ones you get in salmon. I just want to check cod liver oil,
yeah,
salmon, nuts,
salmon.
things like that.
Right. Yeah, absolutely, you got it. So those are the ones in the. So you gotta pick the fats appropriately, and now we've got lots of help. Your doctor, dietitian. There's lots of information you can get about which are the good fats and which foods, like you mentioned. So you have to pay particular attention to that. And also just remember that we talked about HDL, and so although HDL is not really a target, we said statins will usually target an LDL level. Okay, so we'll say depending on your risk, the statin, you'll start the statin, you've optimized your lifestyle, you start the statin, and that will help reduce the cholesterol in the bloodstream. So it'll help increase the disposal of cholesterol by your liver, so of LDL. So that will definitely bring down your LDL cholesterol, and that dose can be adjusted. And then I don't want to go into this, but there are some newer drugs as well. But from HDL perspective, you'll see that further down the HDL, there are also targets, a value of more than 1 for a male, more than 1.2 millimoles per liter for a female. And although we don't have, we don't have really, we can't show that this actually can reduce outcomes or reduce events. Okay, we do know that it actually we can enhance the profile by increasing the HDL. And the things that do increase HDL are the common things that we spoke about. Exercise, if you stop smoking, okay, if you get the diet right, you can optimize the HDL cholesterol, and that will help to lower your total cholesterol and potentially the consequences thereof. So you'll see that there's two other at the bottom. There's two other tests that we look at: non-HDL cholesterol. So that's all the cholesterol minus the HDL. So that tells us about all the other bad cholesterols, and then we also look at the ratio of the total cholesterol to the HDL. So if we can get the HDL high, then this ratio goes down. So we want to try and keep this ratio as low as possible. So we set ourselves targets to try and optimize the ratio of total cholesterol to HDL and optimize the HDL as well. So it is a risk factor. It's something we look at, although it may not be a direct treatment target that that we can affect. But certainly we try and optimize that with the lifestyle things that I mentioned. And although alcohol can do that, we don't drink. So, and in fact, guidelines don't suggest that you start drinking to try and increase your HDL. So that's the profile. And then I did mention the triglycerides earlier on, but I just want to say that triglycerides will be, that's the one that you want to fast, because you don't want to have a fatty meal, because that will go up. And that target is usually less than 1.7. So for ease, we say if we can keep it below 1.5 millimoles per liter, then we also reduce the burden on our blood vessels. And when triglycerides go very high, then there can be other consequences as well. All right, so that's your lipogram test, and to try and understand what your doctor is trying to actually achieve. And I think it's important that you actually are aware of these numbers. So, so you actually know your risk.
So we ran out of time. It's been most educational and informative. And I'm going to sit here and admit that I'm past those recommended ages that you said. But I'm going to be off to Perth soon after Ramadan to take this test and get tested for my cholesterol, because I'm sitting here and thinking, sure, I'm way past those thresholds, those recommended thresholds. But inshallah, it's not too late to do something. And if all of you like me are listening and thinking, sure, I haven't had a cholesterol test, then I think after Ramadan that should be right up on your things to do list there. Just picture the segment and picture Professor Shahed over you like this to say, get tested, get tested, get tested. I'm going to leave you with a final message for our listeners before we conclude.
Okay, so as a final message, I think, take charge. You're the most important person in any disease that you have or may develop. So you need to be proactive, get yourself tested, know your own numbers, and find out if there are any treatments that you can actually use to improve your profile once you've looked at the lifestyle factors. And don't forget, we still got 2 weeks in this month, this beautiful month. We can actually, it's a beautiful month. We don't eat the whole day, and we can eat clean in the evenings. And who knows, we can change the outcome of our cholesterol test next month.
Oh, I love it. Eating clean, I love what you said, eat clean. I'm going to use this one year. So please, let's eat clean. Let's add a lot more salads to our diet, and lots of dates and lots of olives and zaters and good breads, sourdough breads. And look, there is tasty, delicious options that you can do. And then perhaps now and then we allowed to have a small cheat day and just keep it at that, just at one time when you're feeling cheat day, and thereafter I think let's go to the gym and do what we need to work it out. Jazakallah so much. Until our next segment, please keep well, and may you continue having a spiritually elevating month of Ramadan. This is Professor Shahed Omar, pathologist at Path 24 Laboratories.
Okay, Jazakallah for having me on. Assalamu alaikum to all the viewers, and to you, Mariam.
Walaikum salam. We're going to go for a short break, and then we're discussing Ramadan traditions. All this after the break.